Good morning. Good morning. My favorite doctors from the West Coast. Here we are today. Good to see you guys. Today's Friday. As we know, it's the end of the week, end of the fourth week of July, going into August. So, the reason why I do these sessions is because I need everyone to make sure they know what they're doing. A lot of people fall into the trap of studying, and reading, and then they wonder why they don't do well. This happens a lot to people who keep watching videos and people actually jumping on step two that I've been people reaching out to me. They watch online med ed, boards and beyond. They spend 2 months building their foundation and not doing as many questions as they should. And then later they go, well, I've been studying for like 2 or 3 months and all I have is like a 52%. That's a horrible feeling because I know, and you guys know that you push very hard each and every day. But it really is applying. So the way I figured originally was if I saw everyone once a day, that's better for my schedule because I'm very busy throughout the day. But then I don't know what you're doing the rest of the day. So I figured we'll do morning and afternoon sessions, yes. But there's times where we're all very, very busy. And today is the day we're going to do back-to-back sessions on Friday because it is a Friday and have other stuff on my schedule that I have to attend to. So we will be doing biochem in the morning, back-to-back with GI. Those who can stay, great. Those who can't, recording will be up there for your advantage to utilize later, right? So the great thing about what we do is make sure that we know the material. We make sure that we are able to apply the material and also power of elimination, right? Just like our friend Anthony, which I keep bringing up, he's going to be coming up next week to share with you guys all his experience in the test center. Again, not compromising any irregular behavior as far as what was on the test, because I don't really care what was on the exam. I do care, though, that the exam was very similar to Amboss and UWorld. I do care that the free 120 was very similar to the actual exam, and he'll tell you that. NBME is nothing like the actual test. It's just concept. So that's why Tuesday and Thursday mornings, we'll keep doing NBME questions. We'll keep reviewing them. Old questions, obviously retired, because I can't, don't want to bring on new ones. It's not, that's unethical. So that being said, why we have immunomicrobiochem 3 times a week, 4 times in a month is I need you guys to bump your score up. Studying is one thing, applying is another. So today we're doing biochemistry, and now think of it this way. I need you guys to not so much try to cram all of medical school into your step 1 prep. You have to figure out, well, I'm showing you, but you have to get that mindset that we will try to get points, okay? So biochemistry, if you guys like, you guys could put in the chat box what you majored in undergrad, right? If you like, please, if you feel comfortable, put that in the chat. I majored in biochem. I didn't want biochem. I liked chemistry, but I was convinced to do biochemistry, which now I love. But when I went to medical school, a lot of students had difficulties, right? Because they didn't major in biochemistry, majored in biology, some chemistry, some actually history, English, whatever. So the point is, take it from me, biochem is challenging. Do not try to learn it all. It's not easy. But if you can, please. Today is the day where we highlight what we're able to get points, right? So every Friday, if you stick with me, every single Friday, we'll do biochemistry. So think of it this way. We have metabolic pathways, sure, glycolysis, gluconeogenesis. We have TCA cycle, all the different pathways. We also have vitamins, vitamin deficiencies, and toxicities. We have many, many things. Now, I don't know about you guys, genetics wasn't my thing. I never really enjoyed genetics. However, what I did enjoy was the fact that I can diagnose the case. And then they would ask me, well, based upon what you think this case is, right? Is it Duchenne's? Is it Becker's? Is it cystic fibrosis? Do you know if it's X-linked? Do you know if it's autosomal recessive, autosomal dominant? What is it exactly? So for me to you, I'm telling you, pedigrees are not as important as you might think they are. If they give you one, maybe two, all right. Realistically, they're going to try to get you elsewhere. They will definitely, and you'll see some cases today, they'll present you a certain condition, and then they'll say, hey, psst, is it AD or AR? Quick question to the group here on a Friday morning. I know you all know about Marfan syndrome. Yes, you do. Can you tell me the inheritance pattern in the chat box? Is it, I'll give you 50-50. Actually, 33%. Is it autosomal dominant, autosomal recessive, or X-linked recessive? You guys have a choice to choose, right? So some people putting the answers in, awesome. Now, how about homocystinuria? Homocystinuria, is it autosomal dominant, autosomal recessive, or X-linked recessive? Good, there it is. So if you know that, chances are you'll get most of the genetic questions right. Now, again, I'm here to be a test taker to teach you how to pass the test. They might throw you for a loop, but I do my best to show you all the tricks I got, all the different ways to leverage the exam so you can do very well. When you get to DNA and protein, you know, Okazaki fragments, ligase, primase, I'm not sure if you're comfortable with them. I can guarantee purines, pyrimidines. All you need to do is if you have AMBOSS, you open up the questions, open up your first aid. It's all about terminology. Realistic, right? So moving forward, what I want to do, like we do every single day, is I will bring on questions from AMBOSS. Now, if you have access, which you should, to the online community, please do so on a daily basis. If you have any issues, let me know, reach out to me, and I'll make sure you have access to that. I love AMBOSS, and because of that, I share my lists with you. If you have an active AMBOSS membership, you can jump on and literally access all the questions that we do each and every day at your pace, right? It's not completed, meaning if there's 15 questions, 15 from your end, but you'll have the opportunity to answer all of them, okay? At the end of the day, this is just an exam, even though it's one of many to get your license in America, but we have to pass it to move on, all right? So let me know, email me, communicate with me if you have any assessments coming up. Love to meet up with you individually, half-hour sessions here and there to make sure that you're doing well, to make sure you're progressing forward. I love to see you all here, but my goal is to see you on for a month or 2 or 3 months, and then you pass and move on, right? I want you to keep moving in your journey. Okay, so that being said, we will do biochemistry. I'm excited. And then right after that, we'll do GI. Typically, we have the morning, afternoon sessions, but there's times where I have meetings and I don't want to miss a session. So you'll see any updates in our online community where we'll do back to back. Why not? It's a Friday. You guys will be able to hit both biochem and GI back. So biochemistry is coming up. I want you guys to raise your hands. Feel free to jump on, guys. I need to see what you know. And wouldn't you want to see, you know, too? I mean, practice, right? You don't know what I'm going to throw at you. So that's a sense of little stress, like how USMLE just throws questions at you, right? Yeah, that's what they do. So then I will do this. I have questions for you. I want you to answer these questions and see exactly how you can attack them step by step. And moving forward, any questions you have, you always let me know when we'll be able to attack them. Again, Tuesday, Thursday mornings, we hit NBMEs, and also it's open mic. So if you have any questions or concerns, you can always ask in the community, we answer. All right, so raise your hands up. Hi, guys, let's do a couple questions. I chose 14 questions for Biochem. Some you might have seen, some you might not have seen. Some people are here for the first time, so welcome aboard. It's Friday. Looking forward to having you guys for at least a month, so you can pass the stupid test. Right? All right, let's see whose hand. Someone's hands up. Let's see. All right, Dr. O, jump on board, bud. What's going on? How you doing, man? You doing good? Happy Friday.
Good. Happy Friday.
Awesome, guys. And by the way, listen, you guys leave the videos off. You turn on the audio like this. You know, I just want you guys to feel comfortable. I want you guys to participate and move. Dr. O, it's a Friday. May I ask you for biochemistry? Because, guys, we could do questions all day like we usually do. The other day, I think with Dr. Singh, we did like, 10 questions. I think it was yesterday. Yeah, we did knock down 9 or 10. How do you feel about biochem? And how do you feel when you answer these questions? Do you feel strong, confident where the points are at?
I feel okay with biochem. I think there's some things I can work on, like the Okazaki fragments and like all that, like DNA replication and all that stuff. Um, Sometimes I get like polymerase 1 and polymerase 3. I think like polymerase 3 is, I want to say, is like synthesis or something, and 1 is repair. I don't know, like I get that mixed up. And I know like something with the primer and all that.
I mean, don't worry about it. I'm telling you, focus on more metabolism. Focus on where you can get points. It literally is a point game, right? It's not, there's no score. It's a high, I mean, you can get high pass or low pass. I need you to focus attention on what you can get right. And then literally, man, open up your first aid. If you have AMBOSS, open up some questions, learn the terms. If you don't know the terms, man, I promise you, there's more areas to focus on to get more points. This is my strategy. I can't be good at everything. I try, but I can't. But what I am good at is farm, biochem, microimmuno. I'm good at every system, but certain things in every system, right? Like we do organ systems every afternoon. So don't worry about the ligase or paramase for now. I got to get you up and running on everything else. Okay. This is where you can strengthen yourself. So I want you to read the case. This might look familiar to some of us, might not, right? Let's attack the case. Last 3 lines usually, because always gives us a chance for what, Doctor? Why do we read the last 3 lines?
I think because does it give us a chance to kind of like get the gist of the vignette and maybe cut time?
Yeah, you got to cut time, guys. It's a time test. So when I was in med school a long, long time ago, we were always told last line. That was good then, not good now. Typically, last 3 lines will either give you something juicy enough to answer the question or guaranteed you'll know what the question's asking. And I don't know about you. A lot of times I used to make many mistakes. I used to read fast. And because I read fast, I misunderstood the question. So I thought to myself, how do I get my students to pass without making any silly mistakes? Read the last line, then go with last 2 lines, go to the top, because then when you read the whole case, Dr. O, then you actually have read the last 3 lines twice, which means it minimizes the chances of you making any mistakes. Okay, let's do it.
All right. So P shows reddening of the tongue and the findings in the photograph. He is oriented only to person and the short-term memory is impaired. This patient most likely has a deficiency of substance that is derived from which of the following amino acids?
Question. Do you see, and again, pictures I don't like, but there can be advantages to it.
Yeah, I think this one gives it away.
What does it give away? Do you know the condition?
Nice and deficiency.
Good. So if you know this, you can go hit the answer, ideally, right? If you
Yeah.
don't, this is not the Kazal necklace that we know, right? Like we're not familiar with. You can go to the top, and let's go to the top 1 second and see if the presentation can confirm what we're thinking or help
Okay.
us.
So a 19-year-old man comes from a rural field hospital set up by an international health organization in Northern Africa. The man is brought to the hospital by his cousin after being found naked, disoriented, in a garden far away from where he lives. His cousin says this is not the first time the patient has gone lost on his way home. The patient has also had diarrhea for several months. He has no history of previous illness and does not take any medication.
So if you didn't know the picture, because usually if the photo doesn't help, you could be obviously X-ray, MRI, CT, this, it could be logical biopsy, right? Might be pathology. The case itself can give it away.
Yeah.
Right? The only time you're in trouble is if it says 19-year-old male has dysuria and there's an arrow pointing to the biopsy finding. What is that? When I panic, but then clearly it's not going to be very often. Maybe one question about the whole day. All right. Now you know you said it was something with niacin or something like that. Okay, okay. Look at the answer choices. What we got?
Okay. If it is with niacin, then it's tryptophan.
Good.
Um, yeah.
It's that simple, isn't it? really could be, right? We have diarrhea, dementia, dermatitis.